And this clinical trial has been released for the first time in the New England Journal of Medicine in 2017. And we had roughly a 3-year follow-up time. And now we are reporting on a 5-year follow-up time. So COMBI-AD used Dabrafenib and Trametinib, a BRAF and MEK inhibitor in combination, compared to a matching placebo. 870 patients have been treated, and all of these patients were belonging to the so-called stage 3 category of melanoma. It's the AJCC classification, 7th edition, and stage 3A patients needed to have at least 1 millimeter of a diameter in the micrometastasis. Stage 3B and C patients were mainly patients with macrometastases in the lymph nodes. All of these patients needed to carry a V600 E or K mutation. So the patients have been treated for 1 year. So the first data showed already a hazard ratio of 0.47, which corresponds to a 53% improvement of relapse-free survival after roughly 3 years. That was a very good result and much better than anticipated by very many experts in the field of melanoma and oncology in general. The 4-year data comprised, in addition, data on the so-called cure rate model, and it showed that 17% of patients are likely to be cured with a regimen of Dabrafenib and Trametinib for 1 year over a placebo. Now we have the 5-year data, and the curves are very, very stable. So the Kaplan-Meier survival curves flatten, and this is in the interest of our patients, that almost nobody has a progressive disease in the last year. The difference is only 2% in the two groups, which is Dabrafenib and Trametinib, compared to placebo. Now the delta at the tail of the curves is 52%, compared to 36% for placebo being relapse-free at 5 years. This explains the cure rate model, which has estimated a 17% cure rate chance for patients treated with this regimen. So the data are vastly confirmatory. The very first analysis comprised an overall survival analysis and showed in the same range roughly 50% improvement of overall survival, and the next update in overall survival is in about 2 years when the final analysis of COMBI-AD is available. However, we were able to update the distant metastasis-free survival, and this shows a hazard ratio of 0.55, corresponding to 45% improvement of distant metastasis-free survival as first site of a relapse. Also a very good result. So relapse-free survival, distant metastasis-free, and overall survival are so far in the same ballpark, on the same level, with hazard ratios in between 0.50 and 0.55. There is no safety analysis update in the year 2020. The reason for this is very obvious. All patients have terminated the treatment a long time ago because it was just 1 year of treatment, and now we have a median follow-up time of 5 years, and therefore we didn't expect to see any other toxicities coming after such a long time. So with this, I like to conclude that we are seeing an astonishing good result for COMBI-AD. After 5 years, the curves are flattening out, the patients are doing well, and we have the hope to cure patients in the adjuvant setting. I'd like to thank you very much for your attention.